Hi, today at HealthAide Chat, we have Serena Macleod. Serena is a chartered sport and exercise psychologist who supports organisations, teams, athletes and exercisers in the UK, North America and Australia to enhance their performance levels and psychological well-being. She has experience working in a variety of sport and exercise settings, including football, swimming, athletics, rugby, BMX, esports and rehabilitative exercise programs. Today, we will be talking about how to cope mentally with long-term injuries. Many thanks for joining us, Serena. Just to start off with, could you tell us a bit about your background?
Yeah, absolutely. And thank you so much for having me. So my name is Serena. I'm not originally from the UK, obviously. I'm from Toronto, Canada, and I moved over to the UK about 8 years ago. Originally just came over to do my undergraduate degree in sport and exercise psychology. Ended up doing my master's as well as training to become a chartered sport and exercise psychologist. So I've now been here for 8 years and had the opportunity the last couple of years to work within the sports psychology field. Now as a chartered sports psychologist, so I've worked within football, within both organizations and one-to-one, every sport that you can think of under the sun, as well as kind of rehabilitative exercise programs. But yeah, really looking forward to talking to you today about something that I'm quite passionate about.
Brilliant. You were an athlete beforehand. Could you tell us a bit more about your athletic career?
Yeah, absolutely. So football was definitely my life when I was an adolescent. So I started playing football at the age of 4 and played at a high level until about the age of 17. And, absolutely loved it. I was a left back, lived and breathed it. It was really my identity, when I was younger.
Brilliant. And unfortunately, you had some personal experiences in dealing with injury as well. Is that right?
Yeah, so I had 2 significant injuries as an adolescent footballer, and it's actually one of them was when I started playing at a higher level. So I was about 12. I tore all the ligaments in my ankle, and I think that kind of set the tone in terms of me having anxiety about getting injured and re-injury, especially when it came to going in for tackles. That's when kind of I noticed, I was really overwhelmed about, oh, what if I get re-injured? The second one was when I was 17, and that one was a little bit more significant. I basically had a knee injury where I tore all the ligaments in my knee, as well as my plica, which is basically your kneecap. It went to the back of my knee. So it was, quite significant, but I did have surgery, to kind of, help with that, as well as physio. Unfortunately, it was something that was really, really difficult for me in terms of returning to football. I, again, had a lot of anxiety about re-injuring myself, and it really held me back from being able to continue to perform.
So I just want to go to that time when you first sustained your knee injury. What was initially going through your mind when you sustained that knee injury?
Yeah, I think I was absolutely devastated. It was almost like a sense of loss because I kind of feared that, well, now that I've sustained this injury, I'm never going to be able to play at the same level again. I think also at that point in my life, I was 17. I was in college, just started college, but academics really wasn't at the forefront of my mind. Football was really my identity. So I did feel like there was a huge loss, and I kind of had a moment of like, well, who am I, right, without playing football? Because that was the first time that I had, well, a significant time out. I had the ankle injury before, when I was younger, but this was a larger amount of time. And I think, also when you're 17, you're trying to figure out, well, who you are. But at that point, football was all I knew. So, it was really difficult in being able to navigate that, as I felt like I didn't really have anybody to turn to that understood what I was going through as well. So yeah, it was a really difficult experience.
And so, I think you alluded to this already, but do you feel that you had enough support at the time to get you through?
No, I didn't. I think at the time I didn't realize the magnitude of how much it did impact me. I tried to kind of, do other things to kind of get my mind off things, but I didn't really talk about the significance of the injury, the significance of not playing football anymore. We didn't have anything like a sports psychologist. That wasn't a thing, 15 years ago. So yeah, I really didn't feel like I had that support network there. I had other players on my team that had sustained injuries. One player in particular had a lot of concussions and knee injuries. But at the same time, I just didn't feel like I had the space to talk about it.
Okay. And so you're now a psychologist, and you specialize in sports as well. What practical tips would you give an individual who sustains a significant injury to stay mentally strong, using your professional experience and also using your personal experience?
Yeah, and I think that's, a really good point, because my personal experience, although I obviously I'm a psychologist now, I use kind of practical tips based on things that are underpinned by theory. My experiences definitely have helped in terms of being empathetic and compassionate when athletes do experience injuries. I think the first thing, if you're working with an athlete, is really understanding them as an individual, because each individual will experience injury in a different way. Some people, just have the coping mechanisms to deal with it. Some people may have experienced an injury before and being able to kind of cope with it in a different way. But it's really understanding the individual. I think, other things that you can do in terms of kind of really coping with it is firstly a social support network. That is huge. I think, that is one thing that, it's not necessarily anything, like a therapeutic technique, but I think really the athlete feeling supported. And this includes, feeling supported by their players and coaches. Right. I think that's one thing as well, is, sometimes athletes that are injured, they kind of get pushed to the side a bit. They kind of get forgotten about, but it's, really kind of, asking the coaches and the athletes, okay, how can they still feel like a part of this team? How can they still feel like an important part of this club? Because, they will feel like they're left out, right? They're not able to engage in the one thing that they love the most, right? So it's really feeling like they're supported within their environment and still a part of the club. Other things that I'd work on in terms of working with an athlete is something called a rehab journal. So it's kind of keeping track of their rehabilitation during kind of the rehab journey. So for example, let's say that they were doing lunges and squats during kind of their S&C session or physio session, keeping track of that and keeping track of their progress. Because I think one thing, especially when you have a significant injury, let's say that you're out for a year, 2 years, it can feel like you're stuck, and it can feel like, oh, I haven't made any progress. But you reflect back in that rehab journal and you actually see, hey, I made progress, right? A month ago, I could only do 15, body weight squats. Now I can do 12 squats with, 10 kg, for example, right? So I've been able to increase the weight. So I think that's really nice as well. Other things are kind of keeping a diary as well in terms of their thoughts and feelings, having an opportunity to reflect on how they're feeling. That is super, super important. Other things I would work on, I kind of list off like a million different things that you can work on. But if I'm working with an athlete that is returning from injury to playing, I'd work on things like, for example, cognitive restructuring, which basically all that means is helping athletes in changing how they appraise situations. As one thing that is very, very common is when athletes that have sustained a really huge injury, when they're returning from injury, they will be quite worried about getting re-injured again. And that is something that's so normal. So it's helping them in terms of reappraising it, right? Kind of changing their perception of that situation through something called, again, cognitive restructuring. So really helping them take that kind of initial perception and helping them change it, which that would be something that I would do with an athlete one-to-one.
And so when you say change their perception, is it the mindset of the fear of I'm going to injure myself? You try and change that so that you reduce that fear, or
yeah, absolutely. Right. It's just really helping them, because that fear, that sense of fear, right? They'll think in their minds that, okay, it's 100% the case I'm going to re-injure myself, right? But it's helping them kind of change that perception so that overall belief dissipates, right? Slowly it decreases, and then we're actually like, oh no, I'm not going to re-injure myself, right? And it takes a while to change that perception.
I can imagine.
Of course, but that's something that's really, really important, because those thoughts of, oh no, what if I, plant my knee this way, or what if I'm going in for a challenge and I injure myself? That will be very, very normal. And I think that's another thing that I try and do as well as a psychologist, is normalize those thoughts.
Yes.
Because they'll kind of think in their head, there's something wrong with me. Why am I thinking this way? I've done my rehab. Why are these thoughts popping up? So I think it's, that education piece and normalizing that these thoughts will come up, and that's okay, right? That is part of kind of your process of your brain, your body getting used to, being back to playing football again.
Okay, brilliant. So, I mean, I wanted to ask you, what role does a psychologist play in supporting the athlete? I think you've kind of given us good insight from that point of view, but how intensive is your input over the time frame that you're dealing with the individual? Is it something that you need to see them on a weekly basis, or that can be done, or needs to be done more frequently, or does it just depend?
I think it depends on the athlete. Again, some athletes will have, the ability to have different coping mechanisms to deal with it, right? Based on various factors. But if it's an athlete that is really, really struggling, I will see them either on a weekly basis or bi-weekly basis. Just really to kind of give them that support. If I'm working within an organizational setting, I also will talk to, the members of the multidisciplinary team and how they can support them best. So I'll talk to the physio, the safeguarding officer, the coaches, the S&C coach, just in terms of kind of keeping tabs on how they're doing, just to kind of make sure, again, that they feel supported, regardless of who they're working with. I think that's a really important thing. It's embedded within the club that regardless of them being an injured athlete, they still feel like they're being supported. They still feel like they're a part of the club.
Okay. And then final question. So if you take a young aspiring athlete who's then sustained an injury, what 3 tips would you give them just to start the ball rolling in terms of getting themselves back to normality moving forward?
Yeah, no, I think that's a really good question. I think it's firstly kind of normalizing that the thoughts and feelings that come up when you do sustain an injury are normal, right? I mean, you will kind of have those thoughts and worries, come up. And as soon as they do, right, reach out for support, right? It's okay to kind of, reach out to mom, dad, friend, coach, whoever kind of are comfortable with kind of disclosing information. It's okay to reach out for support, right? It's okay to kind of say, hey, you know what? I'm really struggling with this, right? I'm really kind of having a hard time with this. And I think the third thing is, to really work with the multidisciplinary team if you have access to it. If you're going to a physio, work with them and kind of creating a plan in terms of how you can kind of monitor your progress, right? And being proud of that progress as well, right? Being proud of those accomplishments. And it could be, on a weekly basis, kind of reflecting on that and saying, hey, this week I was able to, I don't know, do a squat, right? And last week I wasn't able to do that at all, right? So it's really, taking time to, be proud of yourself, of the things that you do achieve along that journey. So yeah, I'd say, firstly, normalizing that those thoughts and feelings will come up. Secondly, really reaching out to that support network and that support system, and everybody's support network will look very different. So it may be, again, like a coach that you're really close with. It may be, a mate at school. It could be a teacher. It doesn't need to be, a psychologist per se, but it could be helpful in terms of if you are really, really struggling with it. A sports psychologist could be quite helpful. And then the last one is really, keeping that rehab journal and really taking time to monitor your progress and being proud of that progress along the way. There will be ups and downs, there will be challenges, during your rehab journey, but it's really taking those moments to kind of say, hey, actually, I've accomplished so much. And I think those would kind of be, I think those would be my 3 tips.
And on the final tip, when you talk about goals and kind of the journal and what have you, do you talk about just simple, measurable goals that aren't, too difficult to achieve? Is that what you're getting at?
Absolutely. I mean, you can kind of follow the acronym SMART, right? So SMART goals are specific, they're measurable, they're attainable, they're realistic, and they're timely, right? So you can kind of create goals specific to that. I like to say to athletes to create things like process goals. So process goals are basically the kind of specific skills and behaviors that we're working on, as opposed to outcome goals.
Okay.
Because the thing with outcome goals is, we may say to ourselves, okay, I want to return to football in 6 months. 6 months comes and we're not at that point. And that can feel very discouraging. So I'd say to them, work on those process goals. Again, those smaller things that you can work on, such as skills and behaviors. And they're also the things that we can control, right? And really work on those on a weekly basis and, monitor them, reassess them on a weekly basis. Do I need to make this more challenging? Do I need to, maybe actually change it to make it a little bit more realistic, right? But the whole point is to kind of give you that motivation, that confidence that you are progressing. Right, you are getting to that point. Well, the end goal is returning to football, but you are getting to that point that you are moving in the right direction. Brilliant.
All right, Serena, listen, thank you for your time. That's been a great insight into how to manage dealing with the mental side of an injury. Serena's information is down at the bottom of the screen. So please, if you're interested in talking to her more, click on her link and I'm sure she'll be happy to talk to you. All right, thank you very much.
Thanks so much.